Let's start to build our foundation in sleep. Whenever I discuss sleep, I always find it to be interesting to reflect on historical medical perspectives of sleep. Why? Because a lot of our culture is rooted in these erroneous perspectives. Going back to 400-500 BC, a Greek physician named Alcmaeon suggested that sleep was a spell of unconsciousness brought on by the lack of circulation to the brain because of blood draining from the body surface. Similarly, Aristotle also suggested sleep to be an arrest of consciousness, but not in the brain, in the heart instead. The theory of sleep being a temporary coma or a period of inactivity that seemed to follow a day-night or circadian pattern persisted into the 1920s when the electroencephalogram or EEG was developed. EEG allows the ability to evaluate the electrical activity of the brain, and it identified that sleep was definitely not a temporary coma. It wasn't until the 1950s that REM, or rapid eye movement sleep, was identified, which subsequently led to the ability to characterize REM and non-REM sleep and the cycling or ultradian pattern that exists during the sleep across the night. For example, in 1989, Jim Horn suggested that sleep consisted of core and optional sleep, where the first third of the night was necessary and the rest could be optional. So you can see why many of us have adopted a sleep when I'm dead mentality. Unfortunately, this mentality will get you there a lot quicker. Thanks to Dr. Retschevin and his team, also in 1989, the critical importance of sleep to health was made quite evident by their frequently referenced sleep deprivation experiments conducted in rats. What did they find? Well, total sleep deprivation resulted in the death of all rats within 2 to 3 weeks. Selective deprivation of REM and non-REM sleep also resulted in the death of the animals, but over a slightly longer period of time. Progressive sleep deprivation resulted in the rats becoming hypermetabolic, losing weight despite eating more. They developed lesions in their skin, stomach, and intestines, developed inability to control their body temperature, and ultimately died. Further studies showed that these rats died of sepsis, an overwhelming infection, providing suggestion that sleep also impacts the immune system. We now know that sleep is a brain-derived homeostatic process, meaning it's something your body must do to maintain optimal physical, cognitive, and psychological status. There are clear developmental changes in sleep that are observed over time and follow similar developmental gains we expect to see over time in a baby to a child to a teen to an adult. As you can see by this graphic, the pattern of sleep seen in a baby is different from a toddler and forward. In early infancy, the most sleep is needed, but it's divided across the day, with the longest stretch at once occurring in the night. As we age, we shift to consolidating all our sleep to occur at night with progressive reduction in hours needed, and daytime napping stopping around 5 years old. To plant the seed now on its relationship to learning, these patterns make neurodevelopmental sense too. The baby that needs to learn everything should have more sleep, spread across 24 hours, where the 5-year-old will miss out on educational and social opportunities that are critical for their development if they were sleeping during the day. So, have you asked yourself, am I getting the right amount of sleep? If you said no, then consider checking out our sleep hygiene and scheduling resources and incorporate some of these tips to create a healthy bedtime routine. During the day, limit caffeine and try to avoid it within 6 hours of bedtime if possible. Avoid napping. If you must, limit it to 20 minutes. Have a consistent nightly wind-down routine. This helps your brain associate this routine with going to sleep. Only get into bed when you are sleepy. If you're not sleepy, continue your wind-down routine to promote an easier transition to sleep. Try to go to bed and get up at the same time every day, or at least within 1 hour of that time. This helps build your homeostatic sleep drive, which you can learn about more in our next video.